How to get rid of hiccups. The best ways to combat hiccups for children and adults. A sudden hiccup can overtake a person at any moment. Because of this, it is difficult to concentrate not only on work tasks, but also on everyday affairs. If the hiccup does not go away for a long time, it can cause serious discomfort. There are many ways to help cope with this condition at home. What is a hiccup? Hiccups are the process of contraction of the diaphragm and intercostal muscles, which occurs involuntarily. This is a violation of external respiration, which is characterized by short and intense spasms in the lungs. Because of these spasms, air abruptly enters the body, which leads to the closure of the vocal cords. At this moment, the person makes a characteristic hiccup sound. The Latin name for hiccups, singultus, just means sigh or sob. For -60. A person can hiccup once a minute. Why does a person hiccup? The mechanism of the occurrence of hiccups has not been studied 100%, so it is difficult to say for sure why it may occur in each specific case. Causes of hiccups. Taking alcohol or highly carbonated beverages, stretching of the stomach due to overeating or too fast absorption of food, eating too spicy or hot food, lack of sleep, overstrain of the body, including emotional, smoking, sudden change in ambient temperature. Hiccups can also occur due to working in an uncomfortable position and even while laughing if a person accidentally swallows excess air in the process. Hiccups may be associated with a lesion of the esophagus or with the position of the vagus nerve. The vagus nerve, which is closely adjacent to the esophagus, is easily irritated due to careless eating, especially when a person eats too large pieces, as well as when frightened. How to get rid of hiccups. The process of hiccups is individual for each person, on average. This condition passes independently after 10 minutes. However, sometimes there is no time to wait until the hiccups stop. In such cases, you can use popular life hacks that will help stimulate the vagus or diaphragmatic nerve and thereby stop the hiccups. To combat hiccups, first of all, you need to relieve the load from the vagus nerve, for example, straighten up, stretch, or take a deep breath. Top 7 ways to deal with hiccups. Hold your breath. This is the simplest and most effective way to help cope with hiccups. The main plus is that it does not require additional improvised means. Take a deep breath and hold your breath. After taking as much air into your lungs as possible, try not to breathe for as long as possible. 10-20 seconds. For this time, you need to hold your breath to get rid of hiccups. When it is no longer possible to hold your breath, make a slow and smooth exhalation through your nose. If the hiccup has not passed after that, repeat the whole process. A few breath delays should be enough for the hiccup to recede. Breathe into the bag. This method is not much different from the previous one. It will require a regular paper bag. It needs to be pressed tightly to the nose and mouth. Then take measured breaths and exhalations. Make sure that the bag fits snugly in the face so that the air does not come out. If everything is done correctly, the bag will inflate when exhaling and deflate when inhaling. If the head starts to spin while breathing into a paper bag, the process must be stopped. Breathing in a paper bag helps to increase the level of carbon dioxide in the blood, and also allows you to normalize breathing. If there is no paper bag at hand, do not use a plastic bag. It is too dense and can lead to a critical shortage of air. You can replace the paper bag with folded palms, press them to your nose and mouth, and start making smooth inhales and exhales until the hiccups stop. Just breathe. Sometimes just regular breathing helps to get rid of hiccups. Take a deep breath. Count to 5 and exhale slowly through your nose. 10 repetitions may be enough to get rid of the involuntary contraction of the diaphragm. Drink some water. The best cure for hiccups is to drink water in small sips. To get rid of hiccups, you can drink a glass of cold water. Please note that you need to drink the liquid as quickly as possible. Do not stop to catch your breath. Due to this, the brain will switch to esophageal contractions and will not control the contraction of the diaphragm and intercostal muscles. It is best to drink cold water through a straw. It will be easier to take small sips. To further enhance the effect, you can strongly press your palms to your ears, lean forward so that the upper part of the body is parallel to the floor, and drink in this position. An ice cube will help to relax the diaphragmatic nerves. Put it on your tongue and start slowly dissolving. When the cube becomes smaller, it is worth swallowing. Press your knees to your chest. The so-called embryo pose will help calm the diaphragm. Lie down on the bed or sit on the floor and press your knees to your chest, wrapping your arms around them. Try to lean forward as much as possible. 2-3 minutes. In the embryo pose will help get rid of hiccups. Stick out your tongue. This method will help stimulate the vagus nerve, which regulates respiratory and swallowing processes. If it turns out to distract him, then he will stop giving false signals to the diaphragm, and it will stop contracting. Stick your tongue out as far as possible. Try to stay in this position as long as possible, preferably for a few minutes. You can additionally help yourself with your hands. Grab the tip of your tongue with your fingers and gently pull it forward. It is also possible to influence the vagus nerve with the help of the gag reflex. It can be provoked if you lightly press on the root of the tongue. The spasm that has arisen in the esophagus will help to get rid of the contractions of the diaphragm and stop hiccuping. Use the Valsalva maneuver. This method allows you to normalize the pressure in the ears. It is used during takeoff or landing of an airplane, as well as when diving underwater. The Valsalva maneuver also tones the vagus nerve. Thanks to this, it helps to cope with hiccups. How to perform the Valsalva maneuver? Lie down or sit down. Take a deep breath, close your eyes and mouth. Pinch your nose with your fingers. Start exhaling slowly through your nose. Do it smoothly so that the air exits through the clamped nostrils gradually. If you exhale too sharply, you can harm your ears. Repeat the process until the hiccups disappear. Please note that this method is not suitable for people with diseases of the cardiovascular system. The Valsalva method should also not be used during a cold. This can lead to inflammation of the middle ear. What else can I do to get rid of hiccups? Massage the carotid artery, eat some sugar, honey, or peanut paste, eat a piece of lemon or drip vinegar on your tongue. Rinse your throat with cool water. Inhale something with a pungent odor, for example, ammonia. Sometimes it helps to get rid of hiccups by simply switching attention. You can distract yourself by watching your favorite movie, reading, or, for example, solving a crossword puzzle. There are also more non-standard methods to combat hiccups. So the American scientist Francis Fesmire says that having sex will help get rid of hiccups. When should I see a doctor? If none of the methods helps to cope with hiccups, it does not go away for a long time or causes severe pain in the chest and abdominal cavity, you should seek help from a specialist. If the hiccup does not go away for a long time, you need to be alert. Consult a doctor if the hiccup does not go away for more than 48 hours. The specialist warns that prolonged hiccups may indicate oncological pathology, diseases of the esophagus, liver, or lungs. Prolonged hiccups may occur due to surgery, and in some cases may signal serious health problems, such as a hernia of the esophageal orifice of the diaphragm or diseases of the gastrointestinal tract, for example, gastroesophageal reflux. To avoid the occurrence of hiccups, it is important not to overeat, competently make up your diet, as well as observe the work and rest regime.